A 65-year-old retiring today should expect to spend $172,500 on healthcare in retirement. That number is real. It is sourced, it is updated every year, and it is the figure almost every retirement plan quietly budgets around. It is also per person, not per couple. And its own footnote excludes long-term care, the largest single cost a retirement can face. Per person matters immediately. A 65-year-old couple is looking at roughly $345,000 before the excluded items. Every load rating carries conditions. Read them and you learn what was on the machine, when the number was measured and what was left off. This rating was measured without the heaviest load ever applied. Not by mistake, by definition. The footnote says so in plain language. Here is what the estimate covers. Original Medicare, Part A, Part B and Part D. Premiums, co-payments and out-of-pocket costs for care and drugs. Here is what it does not. Over-the-counter medicines, most dental work, and long-term care. 3 exclusions, and the third one can end a plan. Long-term care is not hospital care. It is help with bathing, dressing and eating. The ordinary things from the day they stop being ordinary. Quick thing before we go further. If nobody has read you this footnote before, hit like and subscribe. One assumption rebuilt every week. Most people assume Medicare handles this. 37% of Americans say they plan to rely on it for their health costs in retirement. Medicare does not cover long-term custodial care. Not partly, not eventually. Help with bathing and dressing is simply not a covered benefit. It does cover skilled nursing care briefly and under conditions. This is where almost everyone misreads what they are actually entitled to. For the first 20 days of a benefit period, Medicare pays the approved cost in full. Nothing at all comes out of your pocket. From day 21 to day 100, you pay a daily coinsurance. This year, that runs $217 a day. On day 101, it stops. Everything after that is yours. That is the cliff, and it arrives in a little over 3 months. There is a crueler detail. Coverage can end well before day 100 because it only lasts while you still need skilled care. Get better, and the coverage can end. In most of life, improving is not a financial risk. In this one corner, it is. So, what does the excluded cost run? A private nursing home room has a median cost of $355 a day. That is $129,575 a year. Median nationally. Your own state may be considerably worse. Care at home is cheaper by the hour and not cheap by the year. A non-medical caregiver runs a median $35 an hour. At 44 hours a week, that is roughly $80,000 a year. Simply to stay in your own house with help. Now put the two numbers together. The estimate meant to cover an entire retirement against the annual cost of the thing it excludes. $172,500 buys about 16 months of a private room. 16 months against a whole retirement. And that assumes you spend none of it on what the estimate was actually built for. Premiums, co-payments and prescriptions every year you live. If that arithmetic landed, hit like and subscribe. That is what this channel does. Read the footnote, then rebuild the structure around it. Now, the part people get wrong in the other direction. You will often hear that 70% of retirees will need long-term care. The honest picture is a distribution. About 19% of needs last under a year, and most care is delivered unpaid by family. But roughly 1 in 7 faces a need lasting more than 5 years. 5 years at $129,000 a year. That is the number that ends plans. It is the same argument as the design life. The risk is not the average, it is the tail. An engineer never rates a structure to the typical load. You rate it to the peak it will ever see, then add a margin on top. So how do you rate for this one? Start by naming it. An unfunded, unnamed liability is not a plan, it is a hope. Load Path 1, the health savings account. It is the only account carrying 3 separate tax advantages, and almost nobody uses it as one. Contributions go in pre-tax. The growth is tax-free. Withdrawals for qualified medical costs are tax-free. 3 shields on the one expense that is certain. This year, you can put in $4,400 on your own, or $8,750 for a family. At 55 and over, add another $1,000. And if both spouses are over 55, each one needs a separate account to claim it. Here is the constraint that catches people. You cannot contribute once you enroll in Medicare. For most people, that window closes at 65. And invest it. Only 3 in 10 holders do. The rest leave it in cash and give away the one advantage that compounds. Load Path 2. Earmark a tranche, a specific named block of assets standing against this risk, so it becomes a decision instead of a surprise. Load Path 3. Transfer the risk. Insurance for this exists, and it is a structural trade. A known annual cost against an unknown tail. Whether it suits you depends on your assets and your family. But it should be a decision you actually made, not one you skipped. Load Path 4. Know the default. If nothing is funded, the payer is Medicaid, and Medicaid requires spending down what you have first. That is not a moral failure. It is the system working as designed. But arriving there by accident is very different from choosing it. None of this asks you to predict your health. It asks you to read the footnote on the number you were already planning around. If this rebuilt an assumption, hit like and subscribe. Set the design life to 95. Then fund the load the spec sheet left out. Class dismissed.